I'm Joel Ruiz. I'm a nurse practitioner with Inpatient Physician Associates, and I believe I'm going on 8 years this year. I have been a volunteer with Clinic with the Heart and an employee of Clinic with the Heart for many years now. What it typically does is urgent care style free clinics in the evenings. Bryan Hospital is actually one of the clinic sponsors. Once I became a nurse practitioner, I wasn't able to get to Clinic with the Heart in the evenings, so I emailed Teresa Harms, who's the director of Clinic with the Heart, and asked her, how can I help during the daytime? And she said that Clinic with the Heart and Matt Talbot have been wanting to do a street medicine program for some time now. So Matt Talbot has employees who are outreach employees, and part of their job is to go out to the community, to the homeless community, and provide outreach, whether that be talking about housing assistance or some basic needs like food and water. One challenge would be actually identifying the actual homeless population. So Matt Talbot, Kitchen and Outreach, they help serve this community. So Glenn is the employee who's taken us out the last few times. So he has met them through Matt Talbot, and then also he's been going out for years. So he's actually introduced me and Clinic with the Heart to this homeless community. One gentleman, he had been in an altercation and had been seen in an ER, but had stitches put in, but he hadn't been able to go back. Well, doesn't have a primary care, so he wasn't able to get those out. So I was able to take those out pretty easily. Lots of people asked to have their feet looked at. Some over-the-counter medications have been what they've been asking for the most. Things like hydrocortisone, pain medications, but just Tylenol and ibuprofen. Some folks have had some sprained joints, so getting those wrapped. So that's what we've done so far. When I was growing up, we didn't have, a lot of money myself. So we got care at free clinics, vaccination drives, things like that. So now I'm in a position to where, my job is seeing sick individuals. I've always enjoyed working with people, and especially when they have questions about their health care. So it just seemed natural just to continue to do that in my off time as well. I don't feel like I need to escape working in healthcare. This is different. Working in the hospital, typically the patients are more sick, so that can be stressful. So actually this is quite a bit different. Now you're going to a person and just saying, how can I help you? And just being available with what resources I have on my person, and just continuing what I do on a daily basis for my job. The pandemic, honestly, made me think about how I use my time in general. You already have a career, you already have skills, just continue to use those skills. I didn't need a side hustle. I don't necessarily didn't have another job, but I always enjoyed volunteering with Clinic with the Heart. It's been pretty easy to transition to go into the community and offer medical help that way. Donations are always helpful. Part of Clinic with the Heart's philosophy is that even in the clinic nights, when a patient comes in to receive care, medications will be paid for. Currently, if I write a prescription off of the Clinic with the Heart formulary, 90 days is provided to the person at no cost. So financial donations are always welcome. clinicwiththeheart.org. But right now, it's just me as a medical provider on the team. I am the team leader, so part of my volunteer role with Clinic with Heart is trying to recruit more medical providers, nurse practitioners, physician assistants, physicians. And so if any medical provider has 4 hours a month, between the hours of 1 to 4, that's when we go out. They can send me an email, reach out to Clinic with the Heart, or even just because, again, Bryan Hospital is the sponsor, they can reach out to the Bryan Clinic with the Heart team as well. But we are looking for more medical provider volunteers to go out and provide care where the people are. I would encourage anyone, if they already have a set of skills, just to put those skills to use outside of your primary career. And if you happen to be a medical provider, nurse practitioner, PA, or physician, come volunteer with me at Clinic with the Heart as well.